Assalamu alaikum, dear student. In this session, we have another topic which is prescription writing for myocardial infarction patients. As usual, before writing a prescription for a patient, first of all, we are going to collect the biodata of the patient, in which his name, age, weight, uh, address, and its gender are included. Okay. After writing the biodata of the patient, first of all, uh, in the corner we can write RX, it means to take. For MI patient, first of all, we can prescribe aspirin to the patient, aspirin tablet, which is 75 milligram. Stat means it. These are abbreviation used in medical language, and the stat means at once. Okay, the signa is uh, four tablets at once with water. It means that you should take four tablets simultaneously with water. Okay, in Urdu we can write that uh, चार गुलियां एक साथ पानी के साथ. ठीक है. This was the first tablet for myocardial infarction patient. The second tablet for myocardial infarction patient is glyceryl trinitrate. Glyceryl trinitrate, which is 0.5 milligram. Okay. Cigna, place one tablet under the tongue. Okay. It means that you should place only one tablet under the tongue, and in Urdu we can write is एक गुली जुबान के नीचे. The third tablet is clopidogrel 150 milligram. Cigna, two tablets at once with water. Okay, it means that दो गुलियां एक साथ पानी के साथ. ठीक है, दो गोलियां लेनी है, एक साथ पानी के साथ लेनी है. ठीक है, बस यही कुछ है मायोकार्डियल इन्फेक्शन पेशेंट के लिए ये प्रिस्क्रिप्शन राइटिंग जो मैंने आप लोगों को बता दिया है. थैंक यू सो मच.